No, you're not ready. Let us know whenever you're ready.
Okay.
Okay.
So I knew I wanted to be in the medical field when I was in middle school, so I started taking classes then, and until now, which I still am. I took health science, anatomy, all that stuff. And when I was in my senior year, I took a class about becoming, well, to become a CNA, which I learned everything that it is. So right now I'm currently working at Heartland as a CNA. And so I'm going to tell you the process of becoming a CNA, the differences that I learned between learning it and then actually working there, and then the benefits of someone who's just starting in the medical field and is going out and working. So first I'm going to tell you about the process of becoming a CNA. First you have to complete at least 100 hours of clinicals, either in a classroom or off-site at the facility, like a nursing home or a hospital. You have to become CPR and AED certified in both adults, infants, and children, because they all have different like numbers that you need to do for each in different places, because a baby you need to like, I don't know, yeah. You have to learn the clinical skills, which could be from changing occupied bed to emptying out a urinary catheter. You also need to know how to use measurement forms for meals and input and urinary output. Well, you're not inputting urinary, input fluid, my bad. And vital signs like temperature, blood pressure, pulse, and respiration. Those are important because you need to know what is good and what is bad for the patient that you're working for. And if anything is bad, you need to tell the nurse. And after all that is done, you have to take a written and physical skills test. The written test is about 60 questions, and it's pretty common sense, and it's really easy to pass. And the physical skills test, you have to master 3 skills, 1 short, 1 long, and 1 medium, and you can only get 27 minutes to do so. Having said that, you should know that learning is different from actually doing. My teacher taught me that you're not allowed to like say honey or sweetheart to the patients, but you start to get attached. Sometimes you call them grandma or grandpa, and it's just because you just start to feel a connection with them. You're no longer afraid to touch them, because when I was learning, I was like, oh my gosh, I'm going to break this person or something, but you really aren't, so you get more confident in doing what you're doing. Most places don't have side rails, especially nursing homes, because they're considered a restraint. I don't know why, but we learned how to use it when we're doing our skills. We can no longer, like when I'm working, I can't be like, hold the side rail, so you have to be careful so we don't push the patient off the bed. Lastly, how becoming a CNA can benefit someone just starting out in the medical field. If you decide you want to go in the field and you're just starting low, it can help you decide if you want to stay in the field or where you would like to work. If you don't like working with adults, children could be a better option, or physical therapy, or so on. Or if you don't like the hands-on experience that you get, you can work behind a desk or something like that. In conclusion, knowing that I wanted to be a CNA since I was in middle school and not giving up my dream and working in the field has made me want to pursue my career further in the field. I told you about the process of becoming a CNA, the difference between working in the field and actually learning it, and how it can benefit you if you're just starting out in the field. But I want you to know that starting small and anything that you do can help you, is the best way to success for anything. Fun.
All right.